In this week's Women's Care Wednesday, we are discussing the importance of establishing a primary care physician. And here to explain why is Dr. Sarah Smith with Women's Care Florida. Good morning. Good to see you.
Thank you for having me.
So I feel like I'm getting to know you and your team really well. And to be honest, when I saw this subject of what we were talking about this morning, I told you first thing, I was like, wait a minute, do they have primary care? And you do now.
We do. I started last February, and I was the first primary care physician with Women's Care Florida, and now there is another one in Tampa, and there's one in Orlando with plans for more.
Okay, well, good. We'll talk about the importance of actually, and I don't mind sharing this too, but I think a lot of times as women, you know, when you're certainly the childbearing years as well, you tend to just keep going to your OBGYN, right? You have that relationship.
Right.
Talk about the difference though in the kind of care that comes from an actual primary care physician.
Sure. So that is so common.
Is it? Okay.
So in my office, I work with 8 OBGYNs, and they were finding that a lot of their patients did not have primary care physicians.
Because you get attached to your doctors that you've been with.
So they were finding that when their patients had problems like high blood pressure, or they did blood work and they found that their cholesterol was high or that their thyroid was off, they were referring frequently to other people, or they were treating but not quite in their field.
Yeah.
So one of the benefits of having me in the same office is patients can come right down the hall and still feel comfortable that they're with their OBGYN, but I'm in the same office, we share the same charts, so it's super simple.
I absolutely can see where that would work. That would be a win-win. Talk about some of the testing that maybe you can order that maybe other doctors can't, and kind of some of the things that you are looking for.
Right. So in terms of the OBGYNs, a lot of them do traditional lab work in terms of blood counts and cholesterol and thyroid and, other types.
Mammograms, I know.
Mammograms, right. We have a mammogram right in our office. But for instance, if the cholesterol comes back high, we can talk about treatment for that. We can talk about modifying their cardiac risk factors. We can talk about skin screening and other types of preventative care that are non-OBGYN related.
Well, and you say the importance of basic self-care too, whether that's nutrition, exercise, sleep.
Right.
Talk a little bit about that, what you like to talk a lot about with your patients.
So in the media right now, there is so much emphasis on self-care in terms of taking care of yourself, because then you're more able to take care of your children or, be resilient at your job. But I'm finding from the patients that I see that no matter how much the media concentrates on that, still a lot of women do not take care of themselves.
It's hard.
Yeah,
We're busy.
Right. So we talk about that, diet, exercise, sleep, so important just for self-care in terms of staying healthy.
Yeah. Anything else you would want for people watching this morning and for women watching this morning, and really making sure that they understand how important a primary physician?
Right. I think that one really important thing about a primary physician is just that relationship with a primary physician, because if you have that continuity of care of someone that knows you, when you get sick, you're not ending up brand new in urgent care. You are with someone who knows you. They can help coordinate you to find the best specialist that you need. They can help kind of direct you through the healthcare system, which can be confusing.
Yes, it can.
And just kind of follow all of those preventative care type tests that are super important to prevent cancer or diabetes or cardiac disease.
And real quick too, anxiety and depression. We didn't even touch on that, which I know is a big issue with women as well. And
right. So in our physical, we screen every one for depression, just because it is so common. And a lot of women don't want to talk about it, but if you do the screening test, then they actually think it's okay to talk about, and we can talk about treatment. We have a psychologist that we work with. There's so many medications that are safe and simple and kind of, just help their quality of life.
Well, I think this is such a good move to bring you onto the team, and thank you for being here this morning. You are taking new patients, right?
Right.
So we'll go ahead and put the contact information if anyone has any questions. But thank you so much. We appreciate your time this morning, Doctor.
Thank you for having me.